Hello all, this is Lisa Whitty Bradley. Thanks for tuning in for my Friday night chat. Sorry for the delay. I had a couple of puppy emergencies over here. Just while we're trying to get some more people to tune in, I'm just going to introduce myself. I'm Lisa Whitty Bradley. I'm a board certified plastic and reconstructive surgeon and CEO and founder of Chicks with MDs. This is a platform that I created to help educate, uplift, and empower not only patients but also physicians. Just because of my own personal experiences having to straddle both of those worlds. I started Chicks with MDs about 3 years ago. I was diagnosed with multiple sclerosis in May of 2013, and as a result, I had to not only continue on in the role of physician, but then I also had to navigate the healthcare field as a patient. And as a result, I acquired a significant amount of knowledge about navigating one's contracts, disability, malpractice, health insurance, how to navigate the healthcare field so that it's optimized not only from the perspective of a physician taking care of patients, but also a patient who relies on physicians and other healthcare providers in order to maximize my health and my own personal care. I ideally would like to have these talks during regular work week and not on especially a holiday weekend for many Americans today. Black Panther is coming out, so kudos to everybody who got tickets before they got sold out. But I did want to have this talk which is near and dear to all of us. Tonight we're going to be talking about the impact of gun violence, mass shooting, and terrorism on the healthcare industry. And, unfortunately, there's not a direct correlation when folks think about gun violence and healthcare, although, as soon as somebody gets injured, the first thing we're looking for is how to get them and how to access the best care for them. And unfortunately, the impact on the healthcare field is, it's detrimental to us all. And we're really trying to figure out ways to make sure that people have the best access to care and that we can hopefully start to think about ways to improve outcomes. Hello, I'm not sure who's tuning in, but I appreciate you coming in for the Friday night chat. I think it's just you and I who are not watching Black Panther this evening, but I will be there as soon as I can get a ticket. So if you have a chance, share the video and invite folks to come in and watch, but we're going to talk a little bit about gun violence and the impact on healthcare. Just from my own perspective, I believe in the Second Amendment right to bear arms. The issue that I have with the mass shootings and gun violence in America is that, especially from a healthcare provider's perspective, seeing the trauma and the casualties, the death, the morbidity associated with a weapon like an AR-15, there's really no indication for a civilian to have that type of access to weaponry. There's no indication for that. That is not how you protect your home. You can protect your home with other firearms that do not cause mass casualties. More than likely, if you're just protecting your home, it's going to be one person who's coming in there trying to violate that sovereignty of your home. You have a right to protect yourself. When people are going out and utilizing AR-15s, the intention usually is not to protect their home. They're either doing it because they like to collect those type of guns for their own personal satisfaction, or they're doing it because they want to inflict harm on people. So we have to be able to balance. Yes, I believe in Second Amendment rights, but no, I don't believe in the right for civilians to carry AR-15s. I just don't. I've seen too much destruction and mayhem and chaos. Thanks, Dr. Morell, for tuning in. And so that's why I'm doing this talk tonight. And just, first of all, prayers for everyone who's been impacted by any type of gun violence, especially those people who have been injured in this horrendous massacre in Florida. Please, if in any way you can, help those folks. They have a GoFundMe page, which at last count was at least $200,000 to help the survivors and the families of the victims. But also we want to empower you and educate you so that you can help be proactive going forward. We can't just be about prayers anymore. And that's why when I created the graphic for it, is we can't just be about prayer at this point. We have to act. Jesus was not just praying. He was acting. He was going out, being of service, calling out atrocities when they occurred, helping when he could. We have to do the same. So it's really disrespectful to the victims and to ourselves when we sit back and we pray, but then we stop. We don't do anything else. And I really think that's why we're having such a dilemma in America right now, is because people on one extreme are not only, very stoked in their beliefs, but they also go out and act. Whereas the rest of us are left as lambs to slaughter because we don't have any control over anything, because we're stuck in this space of not being active. So I'm just going to give you a little bit of information about gun violence. So the impact on the healthcare industry annually from just gun violence is $2.3 billion. And that's just ER and inpatient visits. If you take into account lost work hours, losing people to gun violence, the loss annually is $45 billion, okay? Just for people who like to think in numbers. The amount of people killed every year from gun violence in America is approximately 31,000 people per year, and approximately 85,000 are injured. 7,000 children are admitted to the hospital annually for gun injuries. There are 40,000 medical visits per year. There are approximately 96,000 overnight stays across the board from gun violence. So think about those things. It's not just we're stagnant, this happens, and then, we drop off the planet. No, this has long-lasting impacts. And that's just the acute treatment for gun violence. We're not talking about PTSD, anxiety, depression, suicide, lost work hours, because people can't get back. It's, I don't know if anybody's had the chance to see some of these interviews with these kids who are unbelievably strong. These kids are completely traumatized, as they should be, because this is not normal behavior. So just things to think about as we're moving forward. So what resources are available for people after gun violence, whether in the community or in the hospital? Well, acutely, we're going to think about making sure that they get treatment, making sure that their injuries are as well treated and that they can recover from all of these injuries, hopefully. However, afterwards, once you get through this acute period, then you need social services, you need pastoral care, you need psychiatry, you need help groups, whether that be people who are victims of gun violence, or whether the issue was related to crime, or if it was related to drug addiction and a subsequent gun violence. Whatever it is, case management and social services in the hospital can help navigate those things. The other thing that I've seen with the last two mass shootings, which unfortunately is becoming the norm, is the utilization of comfort dogs. And these are dogs that are trained specifically to help people after traumas, such as this gun violence, just to help them with emotional support. And I'm going to list all of these resources in the comments after I'm done, and you guys can feel free to share this post and just get the word out. But there are some other sites. If you have people who are being bullied, these are people who if we intervene ahead of time and we support these folks who are being bullied in school or they're socially awkward. A lot of times with these mass shootings, there is a history of the person felt isolated, the person was bullied, or the person had all of these social issues that unfortunately came to light late, or they were addressed late, or they were never addressed. So we have to provide support for folks. There are a lot of people who are chronically bullied, whether they're socially awkward or they're considered nerds or they're LGBTQ. Whatever it is, we need to provide support for them. So I'm going to list some resources for all of those folks. Now, as a physician, and this is something that I hope docs who are watching, that they take this back into the community. What can physicians do to help? Well, number one is engaging patients in dialogue, especially if you have young kids at home, if you have parents at home, if you're in red states where you know that there's a good chance that there are guns in the home, is talking to parents and teenagers and young kids about gun safety, about gun violence, about the statistics out there. There's a lot of dialogue that, goes unsaid and goes undone because people, number one, feel uncomfortable, but also in states like Florida, physicians actually had to sue for First Amendment rights in order to be able to discuss gun rights and whether or not there were guns in the home with their patients. So there's also that withdrawal, but also know that that is a tactic by the NRA and by conservatives to silence physicians and to silence treatment for gun violence, and also to help promote the purchase of guns. So listening, educating about gun safety and gun violence, getting involved. I am involved in about 2 or 3 organizations that focus on financially supporting candidates that are pro modified gun rights. Okay, so preserving gun rights, but not enhancing the ability of these sick individuals from being able to carry out these atrocities. And I donate financially, I volunteer, I share posts, I support these candidates on social media. Those are things that you can do as a physician, other healthcare provider, or as a citizen. We have to get involved. Inaction just supports the extremists. So it's really important that as much as we can, we are being proactive. The days of trying to debate people who are extreme, those days are over. Those extremists have organized and are now running Congress. So you have to start getting involved. You have to start supporting candidates who are of like minds, who are about preserving our rights and our securities. You got to get out there and get involved. Otherwise, we're just kind of lambs led to slaughter. The other thing is, before you get involved with these candidates, know their background, know their history, know what their voting history is, know what their campaign contributions from small groups and large corporations are, because there's a lot of these people who are going to be controlled by the NRA if they're getting donations from the NRA or any other conservative or extremist group. So you just have to be careful about these candidates that you support. issues that impact gun violence, drug addiction, drug dealing, poverty, hunger, mental health, access to health care. That's something else that really needs to be discussed, is that you can't say that you want to address mental health and then you cut funding for mental health treatment. And that's what's being done with all of these cuts to health care, to Medicaid, to Medicare. The first thing they start cutting are drug treatment programs and mental health. And so you can't, say that you are pro mental health and then cut funding for mental health. It doesn't work like that. So just make sure that you know who you're voting for and why. And, a lot of these people who are going up against these seasoned politicians, they're grassroots. They don't have a lot of funding. And unfortunately, getting out there and getting your word out there costs. So figure out who you want to support, figure out who their backers are. Join, like-minded individuals like yourself, whether you're a physician or if you're in business or you're a lawyer or you're a nurse, whatever it is, there are organizations within your profession that promote and support politicians. Find out and definitely pursue those options. Now, resources for at-risk kids, and please share this with your family members. Share it with if you're in healthcare, share it with your patients. Resources for people who are depressed or consider suicide or just need somebody to talk to, where it's going to be anonymous or where they know it's going to be confidential. There's the crisis text line, which is 741-741. You just text to that number and just let them know that you need help. That's 24 hours a day, 7 days a week. And then there's the National Suicide Prevention Lifeline, which is 1-800-273-TALK, which is 8255. So that's 1-800-273-8255. And then support for our community members who are LGBTQ. There is a huge Facebook page called LGBTQ at Facebook. And then there's also PFLAG, that's PFLAG, and that's at PFLAG on Facebook. And then for kids who are being bullied, there's also at Bullying Stops and at Bully Movie. And I'm going to post all of this at the end so you have this information. So the other thing is maintaining your own mental health and clarity through all this, okay? So I have made the decision for myself, and I think that you should consider this for going forward, okay? Because a lot of people wind up getting in these Facebook dialogues and arguments, and then the stress level goes up, the blood pressure goes up. Try and stick to the facts, and try not to engage in people who are not, they're not conducive to change. They're not interested in doing anything but promoting their own beliefs and ideologies. So stop trying to convince folks that their actions or their beliefs or their thoughts on gun rights, that they're detrimental to society. They already know that, okay? That's why we have the current administration in the White House, is because people, unfortunately, have become pathologically self-centered. And as a result, they are making decisions that only benefit themselves, and they're not really considering the greater society, okay? So stop trying. You're banging your head against the wall trying to convince them otherwise. They are well aware that their decisions are likely detrimental to the rest of society. So just move on. The main thing is to be active, get involved in some of this stuff, and as little or as much as you can do. Okay, if all you can do is go to a website and like, or go to a Facebook page and like and give them one more watch, or whatever it is that you can do. If you can't afford to donate, volunteer. If you can't afford to volunteer, write a great comment on there on a post. Share the post. Very little things, but little things can go very far. There are so many grassroots movements on social media. So just get involved as much as you feel comfortable and as much as you can. We all have busy lives. I get it. So just do what you're capable of doing. But just recognize that my job, our job as healthcare professionals, as human beings, is to care for the community. So what I'm saying, the impact of these things, if they're implemented, are going to help not only pro-gun advocates, anti-gun advocates. It's a collective community, okay? And I actually had a very good discussion on Instagram with somebody who thought I was crazy for saying that AR-15 should be off the purchase list and should not be available. But we had great dialogue. It was like, I'm not here to convince you otherwise. My job is to reach the people who are listening, who want to see what their options are to get involved. I don't have animosity towards that person. They feel the way they do. I feel the way I do. We're moving forward, okay? No, just move on. And then lastly, this is not an either or issue, okay? A lot of the things that you're going to see online are very extreme. You either are pro AR-15s or you're anti-gun. Well, that's, there's a whole meeting in the middle, okay? So this is about advocacy for human rights. This is about advocacy for mental health awareness and treatment. This is about advocacy for adequate health care, whether you are poor or rich, employed, whatever your status is, a child. We want to make sure that everybody has access to these fundamental rights. So, when you think about what you want to advocate for, smarter gun legislation, mental health, treatment, awareness, and support, get involved on the local, state, federal, legislative platforms, and just think about what we talked about in terms of what are some of the causes, or what are some of the root causes of gun violence. So we talked about poverty, crime, drug addiction, mental health, bullying, bigotry, anti-LGBTQ. We want to just keep these things in mind, the things that we can control, the things that we can have a fundamental involvement in helping to curtail. This is not a debate. Time for reasoning and discussion is over. Action is required. Spread facts, educate, share fact-based information, please. I have been at fault for sharing things and then somebody sending me a comment that says, hey, this is not accurate, and I take it down or I modify it or whatever. Be open to that, okay? I use Snopes, SNOPES.com to fact check a lot of things. And most people are very open to that. Like, hey, thank you for putting this up there and letting me know that this was not 100% accurate. The other thing before I sign off, and I thank so much for my Friday night crew for staying with me, do not give up, okay? This is a long haul, long-term commitment. This is like the civil rights movement. This is like the anti-lynching campaign. This is like women's rights. This is like any journey in terms of empowering people. It's going to take time. It's going to take effort. I have complete belief in us all. Please utilize the resources that we talked about tonight. I'm going to list the resources in the comment section. Please list comments if there are political action networks that you think of that you think would be of benefit. If there are anti-bullying or mental health sites that you think would be of benefit, please list them in the comments. And I will see you next week. It'll probably be next Friday again. So absolutely catch the replay, and I'll talk to you all soon. If you see Black Panther, I'm very jealous, and I'll see you guys soon. All right, take care, and have a great weekend.